Now, as South Africa awaits the 2025 budget speech, tobacco products producers prepare to hear tax-related pronouncement on their industry. Vape producers and distributors are pressing for what they say is the need for a balanced approach to tobacco taxation. They say policymakers should consider using taxation to influence behavior and tax tobacco products in proportion to their harm. Co-founder at Vaping Saved My Life, Kurt Yer, joins us for more. Kurt, a very good evening to you. I must say it's quite a catchy name. I do suppose it's for marketing purposes. I don't believe that vaping can save anybody's life. Talk to us a little bit about what you are looking to hear when the budget is released.
Well, thank you very much for your invitation, and good evening to you and to all your listeners. In fact, vaping can save people's lives, especially if they are a long-term smoker. And we know the trajectory of smoking causes at least 1 in 2 of long-term users to die prematurely from horrendous diseases. What we were expecting to see is very different to what we would want to see. We're expecting to see an increase, probably within the CPIX or inflation rate, but what we wanted to see was no tax at all.
Yeah. Okay. Well, let's go back to what you said right at the beginning there. According to medical experts, there is almost no doubt that vaping exposes you to fewer being the operative word, toxic chemicals than smoking traditional cigarettes. That's no doubt, absolutely no doubt. But there's been an outbreak of lung injuries and deaths associated with vaping. So hence my emphasis on saying that, vaping in itself, I mean, the strategy, the marketing, the way vaping has been presented, it's kind of cool. You look, like fashionable and trendy. But insofar as death is concerned when it comes to vaping and the research that has been done, we can't pretend like it can't happen, that there are no dangers. Although, as I emphasize, that it exposes one to fewer toxic chemicals than smoking.
Well, if we think about, when we look at those deaths, I wonder if you're referring to the incidences that happened in the United States between 2019 and the beginning of 2020. And that refers to EVALI, which was related to THC products that were mixed with a vitamin E acetate, which is definitely hazardous to inhale. That does not mean that there were nicotine vapes. To my knowledge and to the knowledge of, for example, Public Health England, Royal College of Physicians, the FDA, numerous other scientific bodies out there, vaping hasn't killed anybody. Those events that happened in the United States was a very small, isolated event based on adulterated products made on the black market. That doesn't mean that these products come from regulated, properly made nicotine vapes.
Okay, I'm not an expert, but I'm looking at the research that's before me, when it comes to the questions around vaping. There are many unknowns when it comes to vaping, including what chemicals make up the vapor and how they affect physical health over the long term. But people, of course, need to understand that e-cigarettes are potentially dangerous to your health, and that cannot be understated. I see you want to say something.
There's no doubt about it.
Yeah,
there's no doubt about it. The products are not harmless.
Yes.
But when we compare to combustible tobacco, according to Royal College of Physicians, Public Health England, these products can anywhere up to 95% less harmful than combustible tobacco. So we need to be very clear when it comes to this information. If you are not a smoker and you are nicotine naive, there is no need to continue with or even start using these products. However, as a smoker, these products have proven to be very effective in helping people quit smoking, as well as reducing the risk that they would otherwise get from combustible tobacco. Now, that's the reason why we believe that taxation is very important here. If you make these products too expensive, you are preventing people from making that obvious choice purely based around the price. And I believe that is grossly inappropriate, particularly in a situation like South Africa, where almost a third of our population are smokers. and the huge impact that it has not only on the individuals, their families, society, but also in public health. So we have an opportunity here to use products that are significantly less harmful and help our 11 million smokers in the country escape the known harms of combustible tobacco.
But in all fairness, when it comes to buying a packet of cigarettes, regular cigarettes, and looking at the e-cigarettes, vaping, or whatever it is, the prices do vary. I mean, it is more expensive. It is a more expensive addictive habit.
It is very much more expensive than if you consider what we're dealing with regards to illicit cigarettes. And we now know, based on studies done at UCT and looking at the market of cigarettes, between 55 and 60% of all cigarettes smoked in South Africa are illicit. And I personally have gone and looked for cigarettes and been able to buy a packet of cigarettes, or haven't bought them, but inquired on a packet of cigarettes as little as 12.50 for a pack of 20s. Now, there's no ways that a vape product could reach that level of price. So therefore, it doesn't make any sense to make these products even more expensive, because we are preventing people from picking up a product that could potentially save their life.
So as you call and press for a need for a balanced approach to tobacco taxation, what considerations do you want policymakers to be looking at here before a decision is made, and the separation that you call for?
I think that's very important, is that we do need to see a separation between the product categories, and that's not been expressed in the current tobacco bill, which is a big problem, is that they treat all these products as the same, and there's no evidence to suggest that they are the same. In fact, the evidence is contrary, is that the products do fetch a very different harm profile. And in places like New Zealand, the UK, and a number of other countries around the world have recognized that these products can be part of the solution. I believe South Africa should be the first country in Africa that should take this opportunity and look at ways and means that we can make these products more affordable for the people that really, really need them. And we need to face it, that the majority of people that smoke in South Africa are marginalized. They are the poor. They are the people that suffer from mental health issues. So therefore, we need to look at solutions to make these products more affordable and more attractive to those individuals. But at the same time, look at ways of making these products not available to the youth, and advise people that are nicotine naive that these products are not intended for them.
Very well. I think that we should expand the conversation in studio. You should be joining us in studio, and let's debate this one out. Bottom line is that electronic cigarettes are just as addictive as traditional ones, but we will be inviting you to studio. We have to expand this one and really battle it out properly. Thank you so much for your time and speaking to us on the show. Vaping Saved My Life, Kurt Yo, speaking to us there about the proposal that they're making in the ahead of the budget speech that's set to be announced later in March.